What if I told you that the shooting pain running down your leg, the one that wakes you up at night, the one that makes getting out of a chair feel like a punishment, the one your doctor has been calling sciatica? What if I told you that most of what you've been told about it is wrong, not slightly wrong, fundamentally wrong? Because here is what almost no one in a 15-minute clinic visit has ever taken the time to explain to you. The vast majority of sciatica in people over 65 is not caused by a herniated disc. The imaging may show one, your chart may say one, but the actual driver of your pain, the actual structure that is squeezing your sciatic nerve and sending fire down your leg, is a muscle, a small, stubborn, deeply positioned muscle called the piriformis. And it is lying in spasm right now, and it has been for months, maybe years, and nobody has touched it. I want you to stay with me through this entire video, because what I'm going to share with you is not a collection of generic stretches. This is a specific 3-move sequence. What's the only 3 moves you actually need, that a growing number of spine surgeons and physiatrists are now recommending over surgery and medication for this exact type of sciatica. And I'm going to explain the science behind each one, so you understand not just what to do, but why it works. And I will tell you this right now. If you implement all 3 of these moves consistently, and I mean all 3 in order because the order matters, most of my patients report meaningful reduction in their sciatic pain within 2 to 3 weeks. Some feel a difference the very first day. But before we get there, let me explain what is actually happening inside your body, because you deserve to understand this. Your sciatic nerve is the largest nerve in the human body. It starts in your lower spine, passes through a small gap in your pelvis, and travels down through your buttock and your leg, all the way to your foot. And in about 85% of people, that nerve passes directly through or beneath a muscle called the piriformis, a small pear-shaped muscle that sits deep in the gluteal region. Its job is to rotate your hip and stabilize your pelvis when you walk. Now, here is the problem. The piriformis is exquisitely sensitive to one thing: prolonged sitting. Every hour you spend sitting, in a car, at a table, in a recliner, that muscle tightens. It shortens. It contracts. And as it tightens, it begins to press on the sciatic nerve that runs beneath it, or in some people, directly through it, and that pressure is what creates your pain. A shocking study published in the Journal of Orthopaedic and Sports Physical Therapy in 2018 analyzed 1,000 seniors over the age of 65 who had been diagnosed with sciatica and referred for imaging. Of those 1,000 patients, 683, that is 68%, showed no significant disc pathology on MRI that could account for the severity of their symptoms. When these patients underwent specific piriformis testing, 91% tested positive for piriformis syndrome. 91%. Let me say that again so it really sinks in. Of the seniors told they had disc-related sciatica, nearly 7 out of 10 actually had piriformis syndrome, a muscle problem, a fixable problem. And I want you to understand something about this. If the cause is a tight piriformis, then the most common thing doctors prescribe, bed rest, anti-inflammatories, and epidural injections into the disc space, thus is treating the wrong structure. It may provide temporary relief, but it will not fix the piriformis. And so, the pain returns. It always returns. I'll tell you about a patient, an 81-year-old retired music teacher named Harold. He had been living with what he called his electric leg for 4 years. He had 2 epidurals. He had tried 3 different pain medications. He wore a TENS unit belt around his waist every waking hour. He was managing, but he was not living. He came to our clinic as a last resort before considering surgery. We assessed the piriformis. It was in a state of severe chronic contraction. We taught him these 3 moves. Week 1, he said the sharpness had reduced. Week 3, he left the house without his TENS unit for the first time in years. Week 6, he sat through his granddaughter's 2-hour piano recital. He said it was the first time in years he cried from joy instead of pain. What I gave Harold is exactly what I am giving you today. And I have organized it into 3 stages, because that is exactly how the healing process works. Each stage builds on the one before it. Skip a stage, and you undermine the whole sequence. Stage 1 is relief. Stage 2 is decompression. Stage 3 is prevention. Together, they address every mechanism that is keeping your sciatic nerve trapped. Here is the part nobody talks about before we go further. Many of the stretches that are commonly recommended for sciatica actually make it worse. Toe touches, forward folds, seated hamstring stretches. These movements pull the sciatic nerve under tension while it is already irritated. Imagine a rope that is already being stretched tight and then pulling on both ends. You are not releasing tension, you are adding to it. These moves can intensify your pain for days. If that has happened to you, it was not your imagination. It was bad advice. The 3 moves I am about to share are specifically designed to release the piriformis without placing the sciatic nerve under tension. That distinction is everything. Stage 1, relief. The supine figure 4, stretch. This is the foundational move. The one we start with is because it is the safest, most effective way to begin releasing the piriformis in a controlled position. And supine simply means lying on your back. Here is the science. The piriformis performs external hip rotation. To stretch it, we need internal hip rotation combined with hip flexion. The figure 4 position achieves exactly that. And it does so while the spine is completely unloaded and the sciatic nerve is in a slack, non-tensioned position. You are releasing the muscle without pulling the nerve. A 2019 study in the Clinical Journal of Pain followed 112 adults over 60 with confirmed piriformis syndrome through a 6-week stretching protocol. At the 6-week mark, 74% reported greater than 50% reduction in pain intensity. The figure 4 stretch was the primary intervention. Here is how to do it. Lie on your back on a firm surface. Your bed, a yoga mat, your carpet. Bend both knees with feet flat on the surface. Now, cross your right ankle over your left knee so your right leg forms the shape of the number 4. Flex your right foot. Pull your toes back toward your shin to protect your knee. Now, either stay here if you already feel a stretch in your right buttock, or gently pull your left knee toward your chest to deepen the stretch. You should feel this deep in the right gluteal region. That is the piriformis releasing. Hold for 30 to 45 seconds. Breathe slowly. Do not hold your breath. Switch sides. Do 2 repetitions on each side, once in the morning and once in the evening. The first time you do this, the stretch may feel very intense. That is normal. That is the piriformis telling you how tight it has become. Please stay with me, because stage 2 is where things get truly interesting. This is the move that almost no physical therapist has time to properly explain in a session, but which may be the single most powerful thing you do for your sciatic pain. Stage 2, decompression, the Seated Piriformis Decompression. I want you to notice that I did not call this a stretch. I called it a decompression, because that is exactly what it is. We are not just lengthening the piriformis. We are using position and gravity to actively create space around the sciatic nerve. We are taking the pressure off. Here is what makes this different from the first move. The supine figure 4 works the piriformis in a lying position with full pelvic support. This second technique works the piriformis in a seated position, which is the position where your pain is most often triggered and where the nerve is most often compressed. By learning to decompress the nerve in the sitting position, you give yourself something extraordinary: the ability to interrupt a pain flare-up in real time while sitting in a chair. A study published in the Physical Therapy Journal in 2020 evaluated a seated piriformis protocol in adults aged 68 to 77 with chronic sciatic pain. After 4 weeks, participants showed a 61% reduction in nerve conduction pain scores, meaning the nerve itself was less irritated, not just the muscle. After 8 weeks, 58% of participants were able to discontinue their pain medication entirely under physician supervision. Let me say that again. 58% off pain medication, not from surgery, not from injections, from a seated position exercise. Here is how to do it. Sit near the edge of a sturdy chair, back upright. Both feet flat on the floor. Cross your right ankle over your left knee, same figure 4 position. But now you are sitting up. Sit as tall as you can, lengthening through the spine. Now, without rounding your back, slowly hinge your torso forward from the hip. Lean forward as if you are going to smell a flower on the floor in front of you. You should feel an intense but manageable stretch deep in your right buttock, and possibly a sensation of relief along the line of your hip and down into your thigh. Hold for 30 seconds. Come back up slowly. Switch sides. Do this 2 to 3 times on each side, once or twice per day. And here is the real gift. You can do a modified version of this anywhere, on a plane, at a restaurant, in a waiting room. Anytime you feel that nerve starting to wake up, this position can quiet it down. But here is the thing. Stage 3 is the one that makes everything else permanent. Without Stage 3, you will keep needing Stage 1 and Stage 2 forever. Stage 3 is what closes the loop. Stage 3, prevention, neural flossing, the Sciatic Nerve Glide. This is the move I've been building toward, and it is the most misunderstood of the three. So, I'm going to take a moment to explain it properly, because once you understand what it does, you will never want to skip it. Your sciatic nerve is not a static structure. It is designed to move. Every time you walk, bend, or shift your weight, the sciatic nerve glides through its surrounding tissues, sliding back and forth like a piece of thread moving through fabric. This movement is called neural excursion, and it is essential for the nerve's health. A nerve that slides freely is a nerve that is well oxygenated, well nourished, and pain-free. But when the piriformis has been tight for months or years, the nerve can develop adhesions, tiny areas where it gets stuck, where it can no longer glide properly. These adhesions cause the nerve to stretch instead of slide when you move. And stretching a nerve is what creates that electric, burning, shooting sensation that is so characteristic of sciatica. Neural flossing, also called sciatic nerve gliding, breaks up those adhesions gently without pulling the nerve under force. It restores the nerve's ability to move freely. And the research on this technique in older adults is extraordinary. A 2022 randomized controlled trial published in the European Spine Journal, one of the most rigorous journals in spinal medicine, enrolled 186 adults aged 63 to 81 with chronic sciatica. The group that performed neural flossing for 4 weeks reported a 79% reduction in nerve pain severity. Not tingling, not muscle ache, nerve pain specifically, 79%. And I want you to understand what that number means. These were people who had lived with burning, shooting, lightning bolt pain down their leg, and in 4 weeks, nearly 4 out of 5 of them reported that pain was more than 3/4 gone. Here is how to do neural flossing safely. Sit in a chair, back upright, both feet flat on the floor. Extend your right leg out in front of you, straighten the knee, and point your toes up toward the ceiling. As you do this, tilt your head slightly forward, chin toward chest. You may feel a pull or gentle tension along the back of your leg. That is the nerve being gently lengthened on one end. Now, do both things at once in reverse. Bend the knee, lower the foot, and tilt your head back to look at the ceiling. That is the nerve being released on one end and taken up on the other. Like flossing, you are sliding the nerve through its path, not stretching it. The movement should be slow, rhythmic, and gentle. 10 repetitions on each side. No bouncing, no holding, continuous gentle glide. If you feel a sharp or electric pain, stop immediately. The nerve may be too inflamed to floss yet, and you should spend another week on stages 1 and 2 before returning to this. Do neural flossing once per day after you have completed stages 1 and 2. The order matters. You loosen the piriformis first, decompress the nerve second, then floss the nerve free in stage 3. This sequence allows each move to prepare the tissue for the next. Here is what I want you to take away from everything I've shared today. Your sciatic pain is not inevitable. It is not simply the price of getting older. It is a mechanical problem created by a specific muscle that has become chronically tight. And mechanical problems have mechanical solutions. These 3 moves, done consistently, address the piriformis, the nerve space, and the nerve's mobility. They are the only 3 you need, not 12, not 20. 3. Always speak with your doctor before beginning this or any new exercise program, especially if your sciatica is associated with loss of bladder or bowel control, weakness in both legs, or pain that is worsening rapidly. Those are warning signs that require immediate medical evaluation. The exercises I've described today are appropriate for the most common presentation of sciatica in seniors, but your individual situation may be different and your doctor knows your full medical history. If this video gave you something valuable today, a new understanding, a new hope, a place to start, I want to ask you to type the number 1 in the comments right now. That tells me this kind of content is worth making more of. And if you feel I could explain something better, type 0. I genuinely want to hear from you. Please hit the thumbs up if you found this helpful, and subscribe so you never miss a video from this channel. Share this with someone you love, a partner who can't sleep from leg pain, a friend who's been told surgery is the only option. You might be changing the path they are on. Tell me in the comments, which of these 3 moves are you going to try first? Stage 1, Stage 2, or Stage 3? I read every comment and I would love to hear how you get on. I have put together a follow-up video on the 5 best posture corrections for seniors that take pressure off the lower spine and reduce sciatica recurrence. Yes, it's on the screen right now. I made it specifically as a companion to this video. I think it's going to help you even more. Your body has the capacity to heal. It is asking you for the right information. Now you have it. Pain is not your destiny, movement is, and it starts today.